Hi, my name is Steve Hodgson. I'm a physiotherapist and director of Hallamshire Physiotherapy. Today I'm going to talk about the lumbar spine and particularly the lumbar spine problems that don't get better. We specialise in the treatment of lumbar spine problems. The chronic lumbar spines, there's usually problems people have had for 6 weeks, 6 months. In a lot of cases back pain does get better, however in certain cases it doesn't, and there's probably 3 reasons. The first is quite easy to exclude. These are the people who've got significant pathology who have got disc prolapses with pressure on nerve and they're getting increasing neurological signs, they're getting pins and needles numbers. They need surgery, and this accounts for probably about 5% of the people we see. It's quite clear cut they need surgery. The vast majority of people have got simple backache which does not have this associated pathology, and there are 2 reasons why this group of people don't get better. The lumbar spine is incredibly robust. Having worked 20 years as a clinician, people look after the spine because of their beliefs, and this is where the psychological side of pain does become a big issue. Naturally, if you hurt, you avoid doing certain activities, and because of that you then start to lose your fitness, you put weight on, you become less active, and often you find that these problems get worse, and this is very common. This can be made worse sometimes by health professionals frightening people by telling them they've got crumbly discs and fall into bits and they've got torn muscles. So you've got to be very careful about what language you use for people and what explanations you give to people. If you give very clear-cut explanations of why people are having problems and the fact that if they use it, they will actually start to improve, you can see significant improvements with people. So the psychological effects on back pain are significant, like there are for most types of pain that we see. The other big factor is why people don't get better is because people start to use the spine in a certain way. We've already talked about why people with pain will develop things called fear avoidance, because they think they're going to hurt themselves when they bend, so they'll stop doing it. But if you start to use your body in a certain way, usually driven by hobbies or activities, sitting at a desk with a mouse in a certain way, we become asymmetrical. And our brain very quickly picks up on these asymmetrical uses of our body, or we're told when we're young to sit up straight and lock our spine in certain positions, or because we're small we can't sit on a chair correctly. All these can have effects upon our movement control of a lumbar spine. It's not core stability, which is I'm not necessarily think is a good idea, but it's control of the movement around your lumbar spine and the associated joints, which contribute to the ongoing problem. When you're retraining people to use the spine, if they come in and they're shifted to one side and got a lumbar spine that's very stiff, if you stretch it and just manipulate it, it'll feel good for 2 or 3 days, but unless you change it, it will go back to square one after 2 to 3 days. The whole basis, certainly from our rehabilitation, is to change what people do long term. This is both changing their psychological beliefs about their body, changing their beliefs about their lumbar spine, and making them use the body correctly. If you combine these things together, you'll often find you can make big improvements, and surprisingly quickly. If you want any further information, please look at our site at www.hallamshirephysiotherapy.com. Thank you.